Today is my topic bronchiolitis. Myself Vijay Solanki, tutor Index Nursing College. तो सबसे पहले हम जानते हैं, इंट्रोडक्शन देख लेते हैं ब्रोंकोलाइटिस होता क्या है। Bronchiolitis is an active viral infection of the lower respiratory tract, affecting mainly infants under 2 years of age with a peak between 3 to 6 months. It is the most frequently lower respiratory tract infection in children within this age. ठीक है, ब्रोंकोलाइटिस एक्टिव वायरल इन्फेक्शन है जो कि रेस्पिरेटरी ट्रैक्ट अफेक्ट करता है मेनली इन्फ्लांट में अंडर 2 इयर्स ऑफ एज चाइल्ड में। ठीक है, age with a peak between 3 to 6 months, it is the most frequently lower respiratory tract infections. Introduction. Bronchiolitis is an active viral infection of the lower respiratory tract infection mainly under 2 years of age with a peak between 3 to 6 months. Okay, it is the most frequently lower respiratory tract infection in the children within this age. Its cause an obstruction of the wall of the bronchioles secondary to edema, mucus and cellular debris, all of them together within the bronchospasm increase the resistance of the small airway leading to air trapping, airway inflammations and ultimately alter athletics. एटलास्टाइसिस। ठीक है, आगे देखते हैं रेस्पिरेटरी सिस्टम वायरल RSV रेस्पिरेटरी sinusitis virus is the most common etiological agents accounting for the last half of the case. Other virus detected in the nasopharyngeal secretion from the children hospitalized with the bronchiolitis are rhinovirus, para-influenza harms, metapneumovirus, Zika virus, coronavirus, influenza and adenovirus and co-infections has been described. There are no different in the clinical presentation depending on the etiological agents, although there can be some difference in the severity. RSV is a present worldwide and 90% of the children will be affected in the first 2 years of the life. It kills annually epidemic of the bronchiolitis. The peak season virus among the countries depending on the environments and meteorological factors, but roughly occur in the winter times. Last spring from November to March in the northern hemispheres and from the maybe September in the south hemispheres. To data, there is no etiological treatment that shortens the course of the disease. Begin the clinical presentation. The most common clinical presentation is that of an infant within a 3 to 4 days history of prodromal syndrome, coryza, mild fever, decrease in the fluid intakes, followed by a progression to lower airway symptoms, cough, respiratory distress within the tachycardia, chest risations, and nasal flaring. Some others manifestation can be especially early in the course of the disease, and sometimes the only manifestation in the younger infants, and hypothermia most frequency in the first 2 months of the life. On examination, the child can appear from having a good general conditions to begin miserable or even lengthy with a variable degree of severity in the respiratory symptoms, from mild trachepnea to air hungers and dyspnea with the chest rashes, nasal firing, flaring, and grunting. There can be fine reels, winds, decreased air entry, or occultations. Assessment. When diagnosed, the next steps is assess the severity of defined as those signs and symptoms associated with the poor finding and respiratory distress characteristic by trachepnea, nasal flaring, and hypoxemia. Their parameters to focus on are the ability of the child to maintain effective breathing, usually clinical parameters, and complementary tests such as pulse oximeters, capillary arteries, blood gases. Some clinical scores have been developed in the attempt to predict the course of disease, but none has been validated to be used universally. Ability of the child to maintain adequate hydration, assessments of clinical signs, dehydration, fluid intake, and diarrhea such as a presence of wet nappy in the last 12 hours within complementary tests if need to, like biochemistries or blood gases. Bronchiolitis की definition देख लेते हैं. Inflammation, bronchial reactions in the young children and infant. Bronchiolitis is almost always caused by a virus. This condition most commonly occurs during the winter's monthly. Causes of bronchiolitis. Bronchiolitis is caused by virus infection, usually the respiratory sinusitis virus RSV. Sinusitis virus is RSV. It's called RSV. Is very common and separated easily in cough and sneezing. Almost all children have had it is by time they are 2. In older children, and adults RSV may cause of cough or cold, but in young children it can bronchiolitis. ठीक है। मेन जो इन्फेक्शन होता है ब्रोंकोलाइटिस को जो कॉज करता है वो RSV साइनोसाइटियल वायरस रेस्पिरेटरी में। ठीक है, सिम्टम्स देख लेते हैं। व्हाट आर द सिम्टम्स ऑफ ब्रोंकोलाइटिस। ठीक है, सबसे पहले होगा ए स्लाइटली हाई टेम्परेचर फीवर्स। ए नॉर्मल टेम्परेचर फॉर बेबीज एंड चिल्ड्रन इज़ अबाउट 36.4 सेल्सियस, बट दिस कैन वेरी स्लाइटली। ठीक है, हाई टेम्परेचर होगा। ए ड्राई एंड persistent रप्सी कफ। ठीक है, सम डिफ़िकल्ट फीलिंग्स, सम डिफ़िकल्ट ब्रीथिंग और फास्ट ब्रीथिंग, नॉजियल ब्रीथिंग, स्नेजिंग्स। What is the best treatment for bronchiolitis? Relieving symptoms. There is no treatment that can get rid, rid of bronchiolitis. So treatment is aimed to at relieving symptoms until the infection resolves. Treatment at home usually includes making sure the children drinks enough and using saline nose drops a bulb section for inflant to keep the nose clear. ट्रीटमेंट देख रहे हैं। Do antibiotic help bronchiolitis? Acute phase 14 days of bronchiolitis antibiotics are usually only recommendation if illness is severe or a secondary bacterial infection is suspected. Ralestone and found minimal evidence to supports the use of antibiotics for acute bronchiolitis. What is the test for bronchiolitis? Doctor will usually start with a basic physical exam when the determining if a child has bronchiolitis. Additional test may be necessary if symptoms are severe. Chest X-ray may be needed to look the sign of pneumonia. A blood test may be needed to check white blood cells counts for sign of infections. ठीक है, चेस्ट एक्सरे के द्वारा जान सकते हैं हम। ब्लड टेस्ट करेंगे, वाइट ब्लड सेल्स काउंट्स। ठीक है, ट्रीटमेंट देख रहे थे हम। बेस्ट नेबुलाइजेशन एक्शन होता है। Does nebulizer help to win bronchiolitis prevention? Because bronchiolitis is usually caused by a virus, this drug treatment is usually not effective. Hypertonic saline, salt water solutions, breathe in a fine mist using a nebulizer may help relieve sneezing and breathing difficulties. ब्रोंकोलाइटिस के कॉज हमने देख लेते हैं। इज अ कॉज वायरस, यूजुअली रेस्पिरेटरी साइनोसाइटियल वायरस। RSV is more common and spread easily in the cough and sneezing. Almost all children having had it has time to two older children and adults. RSV may cause a cough or cold, but in young children It can cause bronchiolitis. ठीक है, ब्रोंकोलाइटिस आल्सो कॉल्ड इन्फ्लामेशन ऑफ द ब्रोंकोलाइटिस देख लिया है। ठीक है, साइन सिम्टम्स सिम्टम्स क्या क्या हो सकते हैं इसके। रिक्वायर a medical diagnosis. This condition started like common cold. सबसे पहले सर्दी, कॉमन कोल्ड होगा, सर्दी खांसी होगी। ठीक है, इसे प्रोग्रेस टू कफ, कफ निकलेगा, स्नेजिंग होगी, पानी निकलेगा नाक में से। ठीक है, छींकें आएंगी एंड सम डिफ़िकल्टी इन द ब्रीथिंग सिम्टम्स माई विल लास्ट 4 वीक टू अ मंथ। ठीक है, सबसे पहले सर्दी खांसी होगी, नाक में से पानी बहेगा, सांस लेने में दिक्कत होगी। दिस इज ऑल डिफ़िकल्टी इन ब्रोंकोलाइटिस। ठीक है, क्योंकि ये सारी चीज़ें फेफड़ों में इन्फेक्शन होने के कारण होती है, दैट इज़ कॉल्ड ब्रोंकोलाइटिस। ब्रोंकोलाइटिस में इन्फेक्शन होने के कारण इन्फ्लाम्ड हो जाता है, जिसके कारण का डिफ़िकल्टी ऑफ ब्रीथिंग होगी, स्नेजिंग होगी, कफ कोल्ड होगा। ठीक है, पीपल माई बी एक्सपीरियंस रेस्पिरेटरी फास्ट ब्रीथिंग, शॉर्टनेस ऑफ ब्रीथ, स्नेजिंग, डिफ़िकल्टी ब्रीथिंग, slow breathing, whole body dehydration, fever, loss of appetite, malaria, cough और nasal congestions। ये सारी चीज़ें इसमें होगी। देख, बहुत अच्छी चीज़ें बता रहे हैं। शॉर्टनेस ऑफ ब्रीथिंग होगी, आपको बता दिया, ब्रीथिंग शॉर्टनेस हो जाएगी, पल्स बढ़ जाएगी, स्नेजिंग होगी, डिफ़िकल्ट ब्रीथिंग, स्लो ब्रीथिंग। ठीक है, डिहाइड्रेट हो जाएगा, फीवर होगा, लॉस ऑफ भूख नहीं लगेगी। ठीक है, तो ये सारे सिम्टम्स हम पता लगा सकते हैं कि इसको, और फिर भी नहीं पता लगे तो हम ब्लड टेस्ट करेंगे, चेस्ट एक्सरे करेंगे। जैसे कि हमने अभी देख लिया, हम क्या क्या इन्वेस्टिगेशन कराएंगे। चेस्ट एक्सरे करा सकते हैं। ठीक है, ब्लड सैंपलिंग कराएंगे, चेस्ट एक्सरे, ब्लड सैंपलिंग। Bronchiolitis is a common lungs infection in the young children and infants। ठीक है, तो बता ही चुका हूँ मैं कि ब्रोंकोलाइटिस इज़ अ कॉमन लंग्स इन्फेक्शन डिजीज़ है, यंग चिल्ड्रंस एंड इन्फ्लांट्स। इस कॉज करेगी इन्फ्लामेशन एंड कंजक्शंस इन द स्मॉल एयरवे। ब्रोंकोलाइटिस, bronchioles of the lungs, bronchiolitis is almost always caused by virus. Typically, peak times for bronchiolitis is during the winter month। ठीक है, सर्दियों के महीनों में ज़्यादा बच्चों में प्रॉब्लम्स आती हैं इनमें। Bronchiolitis start out with the symptoms similar to those of common cold, but the progress to coughing, sneezing, and sometimes difficult breathing symptoms of bronchiolitis can last for several days of week. Most children better with care at home. A small percentage of children require hospitalizations। सिम्टम्स मैंने बता दिया, रनी नोज, डिफ़िकल्ट ब्रीथिंग, कफ कोल्ड, लॉस ऑफ एपेटाइट्स, कफ, स्टफन नोज, runny nose, slight fever, not always present, पर fever रहेगा. After this, there might be a week or more of difficulty breathing, of whistling noise when the child's breathing out of sneezing. My infant also have an ear infection, otitis media. When to see a doctor? If difficult to get your child to eat a drink and his or her breathing becomes more rapid or laborated, can you child doctors? This is especially important if your child is younger than 12 weeks old or has other risk factors for bronchiolitis include premature birth or heart or lungs conditions. These following signs and symptoms are reasons to seek promotes medical attendance: audible sneezing sounds, breathing very fast, more than 60 breaths a minute, trachepnea and slowly, elaborate breathing, the ribs seem to suck inward when the infant inhales. ठीक है. Refusals to drink enough or breathing too fast to eat or drinks, skin turning blue, especially the lips and fingernails, cyanosis. Mayo Clinic to you inbox. Cause: bronchiolitis occur when the virus infects the bronchiolitis, which is the smallest airway in your lungs. In the infections make a bronchioles swell and become inflamed. Muscles collected in this airway which make it difficult of air flow frequently in and out of the lungs. Most causes of bronchiolitis are caused by RSV, respiratory syncytial virus. इसके फैक्टर्स देख लिए हमने: पैरामेचर बर्थ, अंडरनाइल लाइनिंग, हार्ट और लंग्स कंडीशंस, depressed immune system, exposed to tobacco smokes, never having been breastfed, babies receiving immune benefits from the mothers, connected with the multiple children such as in a child's care settings, spending times coveted environments, having siblings who attend schools or get child care services and bring homes the infections. कॉम्प्लिकेशंस देख लेते हैं. कॉम्प्लिकेशंस क्या क्या हो सकती हैं? कॉम्प्लिकेशंस ऑफ द severe bronchiolitis might include blue lips or skins, cyanosis caused by lack of oxygen, push in breathing, apnea, which is the most likely to occur in the premature babies and in the babies within the first 2 months of life, dehydrations, low oxygen levels, and respiratory failures. If this occurs, your child's might need to be in the hospitals Severe respiratory failures may require that the tube be inserted into the windpipe, windpipe trachea to help the child breathing until the infection has run its course. If your baby was born premature, has heart or lungs conditions, has depressed immune system, watch close closely for beginning signs of bronchiolitis. The infection can quickly become severe. In such as a case, your child will usually need to hospitalizations. Preventions. Become to virus as bronchiolitis is spread from person to person. One of the best way to prevention is wash your hands frequently. हैंड वॉश करना हर चीज़ काम के बाद, स्पेशली बिफोर टच योर बेबीज व्हेन यू हैव कोल्ड और अदर respiratory illness. Wearing a face mask at this times is appropriate. If your child has bronchiolitis, keep him or her as a home until the illness is past to avoid spreading it to others. Others common sensitive way to help to curb infection includes limit contact with the peoples who have a fever or cold. If your child is a newborn, especially a premature newborn, avoid exposure to people with the cold, especially in the first 2 months of the life. ठीक है. Clean and disinfected surface and objective that people frequently touch, such as the toys and the orc. This is especially important if a family member is sick. Cover cough and sneezing. Cover your mouth and nose with the tissues. Then throw away this tissue and wash your hand or usually alcohol's based hand sanitizers. Use your own drinking glass. Do share glass with others, especially if someone in your family is ill. Wash hand after. Frequently wash your own hands and those of your child. Keep an alcohol-based hand sanitizer hand for yourself and your child when you are away from homes. Breastfeed. Respiratory infections are significantly less common in the breastfeeds babies. वैक्सीनेशन एंड मेडिकेशंस हमने देख लिया है. ट्रीटमेंट नेबुलाइज करवाना है. ठीक है. ट्रीटमेंट्स बेस्ट वैक्सीनेशन, सारे वैक्सीनेशन करवाना बच्चे को. नेबुलाइज मोस्ट इफेक्टेड फॉर ब्रोंकोलाइटिस. एंटीबायोटिक्स 70 to 14 days. ठीक है. थैंक यू. आज का टॉपिक बस यहीं ख़त्म करते हैं. सारी चीज़ देख ली अपन ने. ठीक है. प्रिवेंशंस देख लिए हैं. कॉम्प्लिकेशंस क्या क्या होती है, कॉम्प्लिकेशंस देख ली. प्रिवेंशन देख ली. रिस्की फैक्टर्स देख लिए हैं. कॉजेस क्या क्या होते हैं ये भी देख लिए हैं हमने. ठीक है. व्हेन टू सी डॉक्टर्स, सिम्टम्स, ओवरव्यू ब्रोंकोलाइटिस. ठीक है. ब्रोंकोलाइटिस लंग्स इन्फेक्शंस है. ठीक है. जिसके अंदर इन्फेक्शंस RSV नाम का इन्फेक्शन होता है, जो जिसके कारण कि ब्रोंकियल्स डैमेज हो जाते हैं. दैट इज कॉल्ड ब्रोंकोलाइटिस. ठीक है, थैंक यू।